Hi, I am Girish Kishnani, and you are watching 5-Minute Learnings. Welcome to the 11th video in the series on personality disorders. Today, we'll explore obsessive-compulsive personality disorder in detail. OCPD is a mental health condition marked by a strong focus on order, control, and perfection. People with OCPD try to manage every detail of life, even when it limits their flexibility or openness. These personality traits are long-lasting, unusual, and often cause problems, especially in relationships. Their need for perfection and rigid control can interfere with daily life and functioning. There's no single test to diagnose OCPD. A clinician will ask about your symptoms and how they affect your life. They may also run physical exams or lab tests to rule out other conditions. To be diagnosed with OCPD, a person must show a lasting pattern of needing perfection, order, and control over themselves, situations, and others. This pattern must include at least 4 of these traits, from the DSM-5, TR. Too much focus on work at the cost of relationships, extreme perfectionism and need to control environments and people, struggles with generosity, refusal to delegate tasks, difficulty discarding worthless items, excessive conscientiousness, obsession with details, rules, or lists, often losing sight of the task's purpose, rigid views on morals, ethics, or rules. Additional signs may include avoiding emotional closeness or intimacy, getting mentally stuck on certain thoughts, reduced emotional expression. People with OCPD often have trouble showing affection and may appear cold or distant. They struggle with empathy and intimacy, which can affect their personal and romantic relationships. To be diagnosed, these traits must significantly interfere with key areas of life, such as work, school, or relationships. OCPD can resemble or co-occur with conditions like obsessive-compulsive disorder, OCD, eating disorders, autism spectrum disorder, other personality disorders. A doctor will rule out these before diagnosing OCPD. While OCD and OCPD sound similar, they are different. OCD is an anxiety disorder, while OCPD is a personality disorder. OCD involves distressing thoughts and urges, while people with OCPD believe that actions are purposeful. Behaviors of people with OCD change over time, while the behaviors of people with OCPD are consistent. OCD is driven by obsessions and compulsions, but OCPD is not driven by obsessions. The exact cause is unknown, but there are theories: overprotective or emotionally distant caregivers in childhood, poor emotional development or attachment, family history of OCPD. There may also be a biological factor. Having relatives with the condition can increase risk. OCPD is one of the most common personality disorders. It affects men and women equally but is less frequent in younger adults. It may occur alongside depression, eating disorders, illness, anxiety disorder, Parkinson's disease. One study estimates that 7.8% of adults may experience OCPD during their lifetime. Most treatment begins with psychotherapy. Options include cognitive behavioral therapy. CBT helps change negative thinking patterns. Psychodynamic therapy explores unconscious thoughts and emotions to promote healthier behavior. Medication. There is no FDA-approved medication for OCPD itself. However, doctors may prescribe antidepressants or anti-anxiety meds to ease symptoms or treat coexisting conditions like depression. OCPD can strain relationships and daily life. Perfectionism, difficulty delegating, and emotional distance may lead to stress and loneliness. Some helpful coping strategies include learning about OCPD. Understanding your condition can help you manage symptoms, managing stress, create a plan to keep stress in check, practicing self-care, make time for your own needs, not just tasks, using mindfulness or meditation. These can help you notice when perfectionism is taking over and help you stay grounded. If you think you have OCPD traits, it's important to talk to a mental health professional. You may not notice how your behavior is impacting your life, but therapy can help you gain insight and learn healthier ways to cope. With the right support, it's possible to improve relationships and overall well-being. That's all for today on obsessive-compulsive personality disorder. Hope you found this video helpful. If you liked it, please give me a thumbs up, and follow or subscribe to my channel 5-Minute Learnings. And do remember to hit the bell icon to get notified of new content. Thanks for watching.